So this is a very basic topic and definitely it should not trouble you too much. So there are two parts to this question. You have to describe in brief the complications of blood transfusion. Like, honestly, complications of blood transfusion are not something that an MS surgeon should really have to study to prepare. And the second part, this has been asked quite a few times, precautions for massive blood transfusion. So there are two parts. First are the complications. Now, complications are not that tough. You should divide the complications as early and late. Okay. So the first slide is showing the early complications. And there are some, the most common is the febrile non-hemolytic reaction. So the second that you see over here, that is overall the most common, febrile non-hemolytic reaction. You must have seen this in your patients that you start a blood product and within a few minutes they start getting fever and rigors. And why does it happen? It is because of pre-existing antibodies, inflammatory cells in the foreign sera. Right. So this easily can be controlled by giving steroids or by giving anti-allergics. So normally we give Avil and hydrocodone. If you want, you can restart it and see. If he does not get a reaction again after your steroid and Avil cover, it's fine. You can continue with the product. So it's not that you have to stop and discard it because these antibodies can be overcome if the product has to be given. So this is one. The second one, which we are seeing, is the hemolytic reaction. Obviously, in today's day and age, hemolytic reaction is absolutely no, it should not happen. Why does it happen? It happens usually because of mismatched transfusion. Okay, like you gave a positive serum, A positive blood to a B positive person. And obviously there will be a massive hemolysis. So there will be fever, chills, back pain, but there can be renal injury. There can be hemoglobin urea. There can be a acute tubular necrosis. Right, which is what you're worried about. These are the two easy early complications. There can be allergies. So there can be urticaria, itching and all. And there are two complications you should be aware of. One is called TRALI. One is called TAPU. TRALI is transfusion-related acute lung injury. Usually it is seen due to FFP. And usually it is seen due to female donors. So if the blood is taken from female donors who are multiparous, they may be having certain components in their blood which cause a transfusion-related lung injury. Basically, it's a type of ARDS, non-cardiogenic pulmonary edema, which develops within a few hours.